lot of questions for Dr. Alok Patel. He's a physician at Stanford Children's Health in San Francisco. Dr. Patel, first of all, Happy New Year to you. I'll have a lot of questions for you. We know what the CDC is saying, that the risk to general public is relatively low. But seriously, honestly, tell me, how worried should we be about this virus, especially if it's mutating?
Well, foremost, Asieh, Happy New Year. It's always a pleasure to be with you, but hopefully it's going to be under less scary headlines. Now, the reality is that the risk is low for the general public. We have no cases of human-to-human transmission. But what is important to know is that we need to be monitoring these cases, even if it's in cattle or birds, because of the potential for a virus to mutate and be able to jump and now start to be able to infect humans more efficiently. So right now, people should just be proactive about the risk factors and about headlines, but not necessarily any type of panic. We just need to be following the science. Now, in this particular case, we're seeing with Louisiana and this individual who passed away from bird flu, this was someone who came into contact with birds in a backyard, potentially recreational birds. But it's important for anyone out there to pay attention. If you are a farm worker or you're someone who comes in contact with animals, to not necessarily handle any dead or sick animals, and if you must, to wear PPE and clean down surfaces and pay attention to raw milk, which can also contain bird flu in it.
Wait, so how do we know if an animal is sick?
You know, I would leave this to some of the experts out there who work every day with animals, but if you have an animal out there who is not behaving normally, or you even suspect that that animal is sick and you are a farm worker, just take the precautions and wear PPE. And if you are someone in the general public and you notice that an animal is behaving odd or you see a dead animal, to call a professional and don't try to go out and handle it on your own.
So if you have a sick dog, don't touch the sick dog if potentially they could be exposed to the virus or may have bird flu.
You know, I wouldn't want to jump and make a leap that dogs are big carriers right now of bird flu because we don't yet have that information.
Okay.
Yes, it is possible for H5N1 to be in multiple different mammals, but the cases right now that we're looking at are mostly in cattle and some of these wild birds. And in fact, the CDC estimates that the majority of cases in the United States are from people who are working in a farm setting with consumer or commercial cattle.
Understood. All right, let me move on to norovirus. Cases in New York City alone, Dr. Patel, are up nearly 1,300 cases in December. That's almost triple the number of December of 2023. Why are we seeing a surge in these numbers, and what's behind it?
You know, it's hard to say exactly why we're seeing more norovirus cases than previous years. It's entirely possible that there's more reporting, there's more awareness, so people are going and getting tested. It's too early to say whether there's a new strain of norovirus that may be more contagious. But Asieh, this is an extremely contagious and hardy virus. Norovirus can survive in low and high temperatures. It can survive on surfaces for days, if not weeks at a time. And just a small amount of viral particle has the ability to infect an entire household. One of the most common ways that people catch norovirus is from other infected people. People may know that norovirus can cause that vomiting and diarrhea, but you can even shed it if you're asymptomatic, which is why it's so important to isolate and clean and disinfect surfaces and wash your hands in public. I'm just going to say, I've seen people in public bathrooms walk out without washing their hands. So make sure you always wash your hands with soap and water, which is more effective at killing norovirus than hand sanitizer is. And as always, to pay attention to headlines about food recalls and outbreaks, because that can often give an indication that something like fruits, vegetables, or oysters may contain norovirus.
You know, when you bring up hand sanitizer, which is my next question, I was surprised to learn that common disinfectants like hand sanitizer or alcohol wipes are not really effective. And you're suggesting washing hands with warm water and soap. Also, the best way to clean countertops, bleach, right?
Absolutely. If you're going to clean countertops, kitchen counter, doorknobs, anything in your house, which I highly recommend, or if you work in a commercial area to make sure you're cleaning surfaces, using a bleach solution is the best way to go. And Asieh, when it comes to stomach bugs, hand sanitizer doesn't always cut it. So even in a healthcare setting, you'll notice that doctors are more likely to use soap and water, 20 seconds if we're dealing with any patients who are vomiting, diarrhea, or we suspect has gastroenteritis or a stomach bug.
All right, we'll leave it there. Dr. Alok Patel in San Francisco, thank you so much.
Thank you.